My guest today is Dr. Eddie Fatikoff. He's a best-selling author and board-certified physician who specializes in internal medicine. He joins me now from Atlanta, Georgia, with an update on COVID-19. Dr. Fatikoff, you're in Atlanta near the CDC headquarters. Can you give us any insight about what the nation's leading public health institute is doing, to increase available tests and combat this outbreak?
Yeah, they're having daily updates. They're actually working with the local hospitals. This kind of gives us a little bit of extra edge where they're communicating with the 3 or 4 major hospital systems that are communicating also with the physicians across the community. So they're doing that. They are starting to report all the big laboratory data, LabCorp, Quest, all the data is coming into the CDC, and they're even changing the guidelines within hours. Like the president said about no more than 10 people, it updated on the CDC website today. They initially said no more than 50 people in a group. That was updated today. And then the hospital systems also send daily updates. The Department of Public Health sends daily updates, and the governor has daily updates. We get plenty of emails in the city of Atlanta with the update COVID-19.
We've all been told to self-quarantine and to practice social distancing. Is this pretty effective at curbing the spread of this?
In Atlanta, it's been pretty effective. They've shut down the schools last week. People are recommended to stay home, have social distancing, home quarantine to decrease the infection and not to burden the hospital system. If you feel like you have an infection or you feel like you might be exposed, we do phone screens at the office before we even let the patients come in, and based on their symptoms, we either can guide them to get tested, come into an urgent care, the ER, or come to our office. That way we avoid transmission.
Speaking of symptoms, for those who don't know, what are the symptoms of COVID-19 and what should people do if they think that they're infected? I know you laid out some, but in some places, people are saying they're unable to get the tests.
Correct. So symptoms they should watch out for. Some people might be asymptomatic, right? Children might be asymptomatic, have no symptoms at all, or you'll have mild symptoms, something like a cough, a low-grade fever. You might have a little bit of sinus drainage, a little bit of phlegm production. Actually, 40% of patients actually have diarrhea and nausea a couple of days before they have the actual shortness of breath and the fevers. So diarrhea is another possible symptom of the COVID-19, but you also have to be exposed with prolonged exposure with somebody that's been infected with COVID-19 or from an area that's been listed on the travel ban. So when patients are calling to my office and saying, I want to get tested, and they haven't been exposed, they just want to get tested just to get tested, that's also something we're trying to deter and prevent, because you want to test people that actually have it and have symptoms.
Right. Now, SARS-CoV-2 is the virus responsible for the current pandemic. It's a close cousin to the virus that caused the SARS outbreak back in 2003. SARS and MERS are both coronaviruses, but are there any other types?
Yeah, there's SARS is a type of coronavirus. MERS is a type of coronavirus that also, all three came from bats as well. And then you have the human coronavirus, which is a common cold, right? So the reason why this virus is able to be so contagious is, think about it. How many people get the common cold a year? Over 1 billion people globally get the common cold. So if this is a common cold virus, it's easy to spread it, but it won't be as fatal for those who are healthy. So if the flu can spread to 9 or 10 people, COVID-19 can spread to 40, 50 people. And that's what makes it so dangerous, because it's more contagious. So the mortality or death rate is pretty low. It's comparable close to the flu if you're under age 50 and you're healthy. But we're just worried about those high-risk patients because it tends to double in terms of risk after age 60, 70, and 80, leading to 14% mortality at this point. So we have to do everything we can. The whole point of social distancing, everything that we're doing right now, is to protect those people that can't help themselves.
So let's talk about those high-risk communities. We're talking about older people, people with underlying medical conditions. Would this include things like diabetes, heart problems, even obesity? In America, we have a lot of people that have these conditions.
Correct. It includes smokers too, includes asthmatics, includes COPD. It even includes mothers that are pregnant because they have a lower immune system, right? So it can include everybody from every single age group. It includes patients with cystic fibrosis, patients who are on biologicals for the rheumatoid arthritis. It includes cancer patients. It includes a whole host of issues we might not think about. It includes, like you said, obesity. It's even a disease, and hypertensive, even blood pressure. High blood pressure can put your immune system at risk, and smoking as well.
Now, why is it that children have less severe symptoms than adults? You know, they may have it and be carriers of it, but they're probably not getting anything severe. What's the science behind that?
So there's a couple of working theories. One of the theories is saying, well, since a third of the kids are actually exposed to the human coronavirus as a common cold, is there some cross reactivity or sensitivity where it's almost treated like a vaccine, that they're actually becoming immune from it? The other argument, which I think is more plausible, is that kids have a weak immune system, immature immune system hasn't developed yet. So they don't have a robust immune system yet that creates the inflammatory cascade that actually causes you to have severe lung issues with the COVID-19. And since they don't have that, they tend not to have any symptoms and it goes away. Versus an adult, what happens is your immune system goes in overdrive, starts releasing these inflammatory markers that causes inflammation. Now you can't exchange oxygen, you get acute respiratory distress syndrome, you go on a ventilator, and then we do everything we can to save you. And that's what the disease leads to, the ARDS that causes the death, not the virus itself, or that causes a pneumonia or something else.
As a doctor, how prepared do you personally think our medical system is to handle this current outbreak?
Well, I think and hopefully I'm accomplishing some of this, I think to not spread panic to the public, because what the panic is doing is hurting us as a country. We can't order protective devices, we can't order masks. If that did not happen, if people did not panic and they knew facts, then all the medical offices across the country would be able to have enough protective devices. All the hospitals wouldn't have to share masks or only have one mask per person, or have to, supply on other countries to get the masks. So my biggest thing is right now, I can do the tests in my office, but I can't order the supplies to properly do it. So my staff is not infected, and so is the nearby patients, right? So I'm limited. So it's great that we have these tests. It's great that LabCorp requests these big labs have this test, but if I can't order from my supplier, what am I supposed to do as a physician? Tell patients, I'm sorry, we have the test, but we can't do it because there's a shortage in supplies.
Wow. There's no vaccine yet, obviously, and people are running out of hand sanitizers. But in the past few years, researchers have developed safer ultraviolet light technologies aimed at killing airborne viruses. What do you know about that kind of technology?
Yeah, I'm actually surprised nobody's talking about it, why it's not been used. This is a simple solution that's inexpensive that we can implement within days, and we can have this country up and running. We can go back to school, it can be placed in airports, it can be placed in all the doctors' offices that have shortages. This could completely change our economy in a few days. And this was a study done at Columbia University by radiologists and researchers. They published this back in 2016 in Nature. And what they showed was UVC light, right? Light that we used to kill germs for the last 80 years that you see in the hospital, right? If you ever leave the hospital room, there's a little robot that goes in there and sanitizes everything with the UVC light, with the ultraviolet light, and kills germs and inactivates the virus. Now the problem with that is you can't be around it because it can irritate the skin, can cause radiation for skin cancer, and can cause cataracts. But this researchers out in Columbia found that if we use a 220 or 222 nanometer UV light, UVC light specifically, then what we can actually do is we can put it on our bodies and it won't penetrate the human skin. It won't kill it.
Wow.
It'll just kill and activate the virus. So this is a light fixture you can put up in your house, you can put up anywhere for a couple $100, and will kill, not only clean the whole surface, will kill everything around, it'll also kill all the virus and inactivated bacteria on your body as well. And so what they're doing in China is that they're actually having these UVC lights on the buses, but they're not allowed to be inside the bus. So they turn them on, they leave, they come back 40 minutes later. And so they're doing that over thousands and thousands of buses every single day in China to help kill the virus and help decrease spreading the transmission. But we have companies are already doing it in the United States. This can be implemented fairly simple, and I don't know why we're doing it.
What is the timeline looking like on this? Some experts say that the coronavirus could potentially go away when we get into the warmer months because of that UV light. How accurate is that information?
That's a great question. So UV light, usually the sun rays, you have UVA, B, and C. And A and B, UVA light is what the sun transmits to your skin. UVB and C light is what the ozone layer actually picks up. So UVC is what we use to kill germs. So does the hot weather help with this virus? My answer is, we look at Australia, who's just finishing up summertime right now, and they actually have more and more cases. Now, one can say a lot of those cases are from travelers coming in, one of those travelers coming in, but what I always tell my patients is, hey, I still have patients with the flu in the summertime. The majority of patients, it will decrease, right? It will level off. So in the summertime, as the president said, and as others have mentioned, it will level off. I don't think it's gonna be rising. It's gonna be leveling off, and you're still gonna have a small percentage that will end up getting the virus, like you do with the flu or the common cold.
Right, now the vaccine is reportedly going to take about a year to be developed. We'll see if that is the correct timeline. You know, viruses can mutate. Even if they do develop a vaccine, how quickly can they get it out to the masses?
Yeah, well, I want to let the viewers know, usually a vaccine takes 15 to 20 years to develop. So the fact that we can get one 9 to 12 months is, I mean, it's unheard of. Now, the novel coronavirus, since it's a novel strain, a novel virus, and they have the genetic code for it, it wouldn't mutate. But let's just say it does mutate, then we would have to update it like we would with the influenza vaccine, with the flu vaccine. Every year, which have to be tinkered with and played with the strains for us to work, right? And the whole point of us, even let's just say we don't have the vaccination, the patients that are getting coronavirus right now, there's a thing called herd immunity, right? They build immunity to it, right? So that it's, in essence, the people that are infected and get better from this are actually protecting the rest of us from spreading it as well with the herd immunity. And that's the whole thing with the vaccines. If 95% of the population gets vaccinated, you're protecting the 5 people who refuse to or don't want to or are allergic to the vaccine. So while the vaccine is a year away, you still have patients right now that are recovering, right? Over 74,000 recovered already, or close to 70,000 recovered. Those are people that are immune to the coronavirus 19 now, or build immunity up to fight it. So they're going to help stop the transmission spread to a certain extent.
Dr. Fatikoff, we're out of time. Thank you so much for sharing your expertise. You definitely made me feel better. Hopefully the viewers feel better as well.
Thank you so much for having me.
The world according to Jesse.
Thanks for watching, everyone. Send us your comments about the COVID-19 outbreak on social media or anything else that you want to talk about. I'll be back next week with more stories ignored by the corporate media. In the meantime, do your part, social distance, and in the words of Governor Jesse Ventura, always remember, when the government lies, the truth becomes a traitor. Stay vigilant.
The world according to Jesse.